cataract surgery and use of glasses. What you shall expect in terms of use of glasses after the cataract surgery based on previous visual experience before the cataract and your previous glasses used before the surgery. Hi there, my name is Alexey and you're at Eye Surgery Explained IOL-adviser channel. If you're new to my channel and you want to know more details about me and my project, I will put a link to my website IOL-adviser.com in the description to this video below and have a deeper discussion with your surgeon based on that information. And if you're a surgeon, I encourage you to use the tool as well because it will help you to save your time and to streamline discussion with your patient to a more productive way. And now let's come back to the topic of that video. Honestly, talking about the use of glasses after the cataract surgery, especially taking into account your previous refraction and previous use of glasses, is quite a complicated topic which will take a lot of time. That's why in this video I will explain just a general rules and general, let's say, direction of use of glasses after the cataract, especially with prior myopia or nearsightedness, hyperopia or farsightedness, and or astigmatism. And in my next videos, I will dig deeper into details about the cataract and low myopia, cataract and high myopia, and cataract and hyperopia and or astigmatism. But again, it will be a separate video, so if you are still not subscribed to my channel, please do it right now and switch on notifications to stay tuned and to dig deeper into these essential topics. First of all, to understand how the glasses and cataract surgery relates after the surgery, we have to understand and we have to know how our eyeball and how our vision works in cases of normal vision and in cases of refractive errors or impaired vision by refractive errors. And let me explain first of all, let's say, the natural human vision in a young healthy eye. As you may know from the basic eye anatomy, the eye is a combination of two lenses, the cornea and the inside crystalline lens. And the purpose of these lenses is to focus all incoming light rays, which comes inside of the eye through the pupil, to be focused sharply on the retina. And then when the image is focused on the retina sharply, you can see it by using your brain. It's very, very short explanation. And what is important here? The important point is that our eye designed by nature in that way that normal healthy eye is able to see clearly on the far in the infinity distance from observer's eye to the infinity objects, let's say 10, 100 meters, kilometer from your eye, etc. So we call it infinity when we cannot measure the direct distance from your eye to the infinity. And it is designed by nature to see at infinity. But as you know, you can read and you can see the small tiny objects up close. You can read, you can do something, let's say some tiny work, etc. And to do this, we have a so-called accommodation mechanism. What does it mean? Our inside natural lens can accommodate, can change its shape like autofocus in the camera to focus your incoming light rays, which are focused by nature to the far, to infinity, to be focused on your near objects, to get a clear picture of near objects on your retina. So this mechanism works virtually from your childhood, from your birthday, till about 40 years old. And then after the 40 years old, accommodation became to decline noticeably. So honestly, it declines through all the years of your life, but you can notice these changes about at the age of 40, somebody earlier, somebody later, but generally it affects all the population. So we are talking about young healthy eye and the status when the eye is able to see clearly at the infinity, called emmetropia. So it means that eye doesn't have any refractive errors. Okay, I hope this part is clear, but if not, please write me in the comments below and I will try to explain you to the best of my knowledge and try to help you to understand all the topics. And by the way, one more question. In my previous video, some subscribers told me that my speed of communication is a bit high, or it was a lot of cutting in the video edition process. So could you please tell me now if my English or my, let's say, editing process improved in this video? So I will be grateful for your feedback to understand if I'm improving or not and what I should work on. Okay, now let's move to refractive disorders. Refractive disorders are nearsightedness or myopia, farsightedness or hyperopia, and astigmatism. And basically, nearsightedness and myopia and hyperopia might be mixed with astigmatism, or astigmatism might be a separate condition. So generally, what does it mean myopia, hyperopia, and astigmatism? Myopia and hyperopia is a status of the eye when the optical system doesn't match the eyeball size. What does it mean? It means that optical power of cornea and the lens is not finely tuned to the eyeball size. That means that incoming light rays are not able to be focused sharply on the retina. And that's why the person's visual acuity is lower than normal, lower than usual. Coming back to astigmatism. Astigmatism is a different curvature of the cornea because theoretically the ideal lens should be shaped like sphere, and astigmatism is a kind of optical surface of the cornea when the sphere is not, let's say, even. It has a different curvature in different meridians. So it looks like not ideal sphere, like a, let's say, soccer ball. It looks like a baseball ball. And what does it mean? It means that incoming light rays coming through that type of cornea are focused, let's say, in different locations, and astigmatism is more, let's say, complicated condition, which also has to be, let's say, corrected. Okay, what is corrected? If you have an optical disorders, as I mentioned before, we have to place a special lens to correct the optical disorders to, let's say, to change the optical system of the eye to be back emmetropic again. And in this case, we either have to use glasses or contact lenses to change human vision from myopic or hyperopic status to emmetropia, to normal vision. And what happens when you put on your glasses or contact lenses? It means that your vision from myopic became emmetropic. The same with your vision if you're a hyperopic, you became emmetropic. So what is important here? If you compare two patients, one who was lucky to be born without any eye diseases, and another one who was born with nearsightedness or farsightedness. So when another patient, like a patient with nearsightedness or farsightedness with myopia or hyperopia, put the glasses or contact lenses on, that person with the glasses became emmetropic patient, exactly equal to patient without glasses. And when this patient took the glasses off, he or she again becomes myopic or hyperopic. Put glasses on, the patient is emmetropic. Why it is important to understand? Because when we undergoing a cataract surgery or refractive lens exchange, we are able to change that type of eye conditions, I mean hyperopic or myopic patient, to emmetropic patient by simply adjusting the power of intraocular lens, of the lens which are put inside of the eye. And what does it mean? It means that after the cataract surgery or refractive lens exchange, the person who was used to use the glasses in the daily life for normal far vision, and in young ages, these glasses was used for, let's say, all the daily activities, is able to get rid of these glasses because with a new lens, with a new implanted lens, the person will be emmetropic, like the normal one who was lucky enough to be born without eye conditions. But here is one important point. At the beginning of the video, I've mentioned accommodation mechanism, which adapts to the different, let's say, distances from the eyes. And the problem is when the accommodation declines, when the accommodation degrades with age, the healthy guy who was born without any issues starts using glasses for near distance for reading because accommodation mechanism degrades, and near vision and cannot accommodate, and near vision degrades. And to see sharply at near, this person starts to use glasses. And when we put an intraocular lens, we theoretically have some intraocular lenses which are accommodating, are trying to accommodate, but still we don't have any, let's say, commercially available lenses on the horizon which are restoring accommodation to an acceptable level. And nowadays we have 4 types of IOL which restores accommodation to the certain extent by using optical principle, so-called pseudo-accommodation. So virtually no intraocular lenses of today are able to really accommodate, to change its shape, to change, let's say, optical power to see clearly at the near. And as an intraocular lenses are not able to accommodate, we have to use glasses to correct the near vision. And as the intraocular lenses are not able to accommodate, the scenario of glasses used after the cataract surgery depends on 2 factors. The first one is the type of IOL used. So if you're using the standard monofocal, you will need glasses for near and an intermediate. If you're using the full range of vision lens, you virtually will not need the glasses for any distances. And if you're emmetrop, it's more or less clear to you. But for instance, if you're a myop and you are, let's say, low to mild, you had low to mild myopia about -2, -3, you normally was able to see clearly without glasses at near. You had a natural ability to see extremely sharp, extremely well without use of glasses at near distance, let's say 20, 30, 40 centimeters, depending on your myopia. From another side, for the patient with mild hyperopia, you was able to see clearly without use of glasses, let's say till your age of 30. So generally, it is a lot of scenarios of glasses used before the surgery. And if you was ametropic, so never use glasses before the surgery, except probably near vision reading glasses, after the surgery, you will still be ametropic because your surgeon will try to calculate the lens for so-called ametropia. And in this case, use of your near or intermediate vision glasses or your progressive glasses will depend on IOL type. I have a dedicated video about different range of vision with different intraocular lenses. I will put link here again and in description below. Plus, you can read about this on my website, IOL-adviser.com. So I will skip this section now, explaining how you will see with different lenses if you're ametropic. And coming back to scenario when you had refractive disorders like myopia, hyperopia, and astigmatism and glasses use. So if you, before the surgery you was mild myopic and you decide to see clearly without glasses at near with your surgeon, you can be left slightly myopic, or let's say mild, you can have mild myopia after the surgery to see clearly here at this near distance. But for far vision, you will need glasses for far vision as you used in your young ages. If you had mild or high hyperopia, normally there is no chance for you to keep that, and surgeon will try to put you to ametropia. The same applies to astigmatism. Doesn't matter, is it standalone astigmatism or astigmatism combined with mild or high hyperopia, myopia, whatever. Astigmatism shall be corrected, and it shall be corrected either by surgical technique, by special type of incision, a special type of surgical technique, or with special toric lenses. And toricity of the lens is not kind of special type of lenses. However, some manufacturers are tending to, let's say, to separate toric lenses as something special. Toricity of the lens is just an optical, let's say, feature of the any lens type, which helps you to reduce your astigmatism to essentially zero, more or less. And if you're moving from status of high myopia or hyperopia with or without astigmatism to the cataract surgery, after the cataract surgery, you will become ametropic as a young, healthy eye of your, let's say, neighbor who was lucky enough to be born without eye diseases. And scenario of glasses use, as I mentioned, will depend on type of IOL you will select, which will restore your pseudo accommodation to, let's say, to compensate lack of accommodation of the modern intraocular lenses. And here is an important point which I will uncover in my next videos. The quality of vision and visual acuity at different distances will depend on IOL type, IOL model, and what is more important, subjective perception of your visual acuity and your subjective feeling of your visual acuity will generally depend on the type of lens and your previous visual experience. And it is most important point because vision quality is very much dependent on perception, because we are not able to measure my visual acuity and your visual acuity in terms of our perception. Because if I say something is I see well at some distances, and what it means well for me means absolutely different well for you. So stay tuned, and in my next video I will explain first of all the specific of mild myopia and intraocular lenses use and visual experience after the surgery.